Hello and good evening, I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. 266 people died by suicide from March to October, during which we had that series of movement control orders. Now, this averages to more than 30 suicides per month, or one every day. This is significantly higher than the suicide rates that we've seen over the past 5 years. Ardy Ayadali is the publicity director for Befrienders, which offers Befrienders KL, which offers emotional support to those who are distressed, feeling depressed or suicidal. Ardy, how much do we know about the reasons that have led to the higher number of deaths by suicide during this period? How much of it would you attribute to not just the pandemic and the lockdowns, but also the economic fallout subsequent?
Yes, I think the pandemic, COVID-19 pandemic, has greatly attributed towards the increase of suicide in the country. This is also reflected with our own statistics, because we also receive high number of calls on a daily basis because of this. And most of our callers, actually 40% of those who actually call in are talking about suicide or have suicidal ideation. So that's very alarming.
Is that higher, Ardy, is that higher than, say, the period before the pandemic began?
Yes, it is higher, because previously we are only averaging around 90 to 99 calls per day, but now our calls have gone up to around 110 to 115 calls a day. So that's definitely higher.
Ardy, what is it that you and the people who work and man those lines are getting? What kind of stories are they getting from people who are calling in? What is the source of their sense of desperation or hopelessness? So
mainly it's those who actually call in mainly because they have psychological or mental health issues, and this can actually also lead to suicide ideation. And I think with the pandemic that's going on, so there's a lot of uncertainties, a lot of changes that's happening. So some of them, they couldn't cope because they probably lost their job, or they don't have stable income and they are stuck at home. So these are some of the factors that contribute towards that mental health issues that they are having.
One of the things that we've seen in terms of what was revealed with these statistics, Ardy, has been that more than half of those deaths by suicide were those aged between 20 and 40. And I'm wondering why it is that, you know, people in the prime of their lives are seeing such desperation that they see suicide as the only way out. What have you heard? What has Befrienders been observing?
It's mainly because of the intense pain that they are experiencing, and they couldn't find a way to actually reduce the pain. So for them, in order to actually shut down the pain, death is the only way for them. So this is this actually increased the risk factor for this, especially this age group, for them to be even more at risk for suicide.
Ardy, in terms of demographics, is this age group unusual? Does it fit, you know, previous patterns? Are you seeing any abnormal spikes in terms of demographics?
When it comes to suicide, I think previously the statistics indicate that there are more people who die by suicide. I mean, most of the time, the old generation, but so yeah, it is alarming, and I think more research needs to be done.
Ardy, I'm sorry, we lost you a little bit with that answer. Would you mind repeating that answer to Sharaad's question about whether this is an abnormal trend? Maybe you can start from the beginning.
Oh, okay. Yeah, so this is actually quite alarming because previously, if you look at the statistic, when it comes to the age group, most of those people who actually died by suicide are the older generation, but the number has swung to the younger generation currently. So it's very alarming to see this trend happening and also continuing. So it could be because their coping mechanism is different and they couldn't cope with the life changes and pressure that they're going through. So, I mean, there's still a lot that needs to be done to be able to tackle this issue.
Right. Can I ask you about the, the provision of care for suicide survivors and their families? Now, of course, they're not just faced with kind of grief and stigma and shame, but also sometimes suicide survivors are faced with criminal charges. Can you talk to me a little bit about the impact of this law, this very archaic law that has on suicide survivors and their families?
Yeah, so basically when we talk about the Section 309 law, we have to ask ourselves, is this even a deterrent for people to not attempt or commit suicide? Because, I mean, if you look at the statistics, people are still ending their life for whatever reasons, and it's no longer a good deterrent. Based on experience, manning the hotlines, when people are talking about taking their life, actually from experience, none of them actually say, oh, I'm not going to kill myself because I might be fined or jailed. That has not ever come across to me from experience. So the law needs to be repealed so that it can signal to Malaysian society that, suicide is not a taboo subject and it's not a crime, but it's a mental health issue, and this needs to be addressed the correct way, instead of punishing them and putting them in jail or fining them.
Thank you so much for speaking with us tonight, Ardy. We really appreciate your time. Now, if anyone, you or anyone you know, is affected by this conversation, we've got here some resources that perhaps can help. Let's put it on the screen. We're going to take a quick break here on Consider This, but we'll continue this conversation in just a few minutes. Stay tuned. Hi, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. More than 260 people have died by suicide in the past 8 months. That's more than 30 suicides per month, or 1 suicide death each day. Joining us on the show tonight to discuss mental health awareness and suicide prevention, we have Associate Professor Dr. Amer Siddiq, Amer Nordin. He's a consultant psychiatrist at University Malaya Specialist Centre. Good evening, Dr. Amer. Now, I looked at the statistics, and more than half of those who died by suicide during this period were those aged between 20 and 40. Dr. Amer, how are you reading these numbers? Is this an abnormal trend of suicide deaths in this specific age category?
Hi, well, thank you for having me. This is first time being on this thing. So, no, the numbers are not uncommon. Often we do see the deaths to be in the younger age group, the one that you've actually mentioned. The second category would be in the elderly age group as well. So this is numbers that we often cite in terms of risk factors for suicide.
Dr. Amer, apparently these numbers are high in the sense that compared to the previous 5 years, we didn't have as many suicides. How would you start to account for, what must be a really complex picture, but how would you start to account for this rise in suicide rates?
Well, I think suicide has always been there. It's just that there's been a little bit more, in a way, awareness and also data taking in terms of people who might have died in suspicious circumstances. So I think that could be one way of looking at it. Also, the other thing is that we definitely have had a number of high-profile cases where these have been reported in the mass media, so people are a little bit more in tune with the idea that some people might be leaving us earlier than intended.
Right. Is that a problem? I mean, in terms of the reporting practices of those who have died, the media's reporting practices of those who have died by suicide, does that open the door to, you know, those who are susceptible to imitative suicidal behavior?
Well, definitely, there definitely is a situation where we need more data. We initially had the National Suicide Registry a number of years ago, but due to certain reasons, it's been a little bit more dormant. More recently, there's been a revision in terms of reviving that particular National Suicide Registry, which I think will be definitely helpful in getting more appropriate data. I know that we've heard a little bit about suicide cases that have actually risen or at least been reported in numbers that are numbers that we don't like to see, right, by the police. However, I'm pretty sure that there have been other cases that have not been reported, and therefore the suicide registry is something that is very useful for us as a country to actually look at the actual numbers and therefore have plans to actually mitigate these particular numbers as well for the country.
Sorry, Dr. Amer, could I clarify? You said that the National Suicide Registry, there was once a national registry to track deaths by suicide, but now we no longer have that data. Is that accurate?
Yes, so the Suicide Registry had actually was with us for quite some time, and then I think due to funding support, funding reasons, I think it's been actually dormant. But then has been recently revived or will be revived very soon.
Dr. Ahmed, there are of course people who are associating this rise or spike in suicide case to the pandemic, to the lockdowns, to the economic dislocation it's caused. And perhaps we're drawing too easy conclusions from it. But would you kind of hazard an interpretation of this? Do you think we can sort of, as it were, blame lockdowns for and the economic fallout from it for these suicides?
Well, Sharaad, actually the numbers that, the pandemic has actually definitely been a contributing factor to many people's woes. And we've already, and I myself have actually mentioned that we would be seeing a rise in mental health issues, and as a result of it, the consequence of mental health or severe mental health, which is not taken care of, which is going to be suicide. And this is what we've been sort of advocating very early, that we should have plans and also strategies in place, particularly at the end of the year, moving towards the early next year, because we know that the economic fallout because of pandemic, the prolonged stress as a result of the continuous uncertainty of these, the situation, lockdown, no lockdown, for example, will definitely increase the strain on mental health. Right. And for some people, there might be the situation where they might then, commit suicide as a result of the inability to manage their mental health well.
Okay. What kind of plan would you like to see, Dr. Amer? Because as I understand it, Malaysia already suffers from a lack of clinical psychiatrists. I think we are about 7 times below the recommended number per 10,000 population as recommended by the WHO. What kind of plan would you like to see taking into account this serious deficit?
Well, I think, first of all, the good thing is that we still continue the mental health psychosocial support system, but I think we need to really expand on that. That was one of the recommendations that was actually done by a colleague of mine here in Malaysia, written in the Lancet, together with colleagues looking at suicide as a result of the pandemic. So one of the recommendations, a good public health recommendation, is actually to increase and expand, in a way, telecounseling through, for example, the 15999 or to support agencies like Befrienders so that they can actually cater for people that might need some level of mental health support. That's the first one. The second one, of course, is to provide some level of counseling services that is really made available for all Malaysians in the many services that we have. For example, under the Ministry of Health and also relevant non-governmental organization. I think this is something that is needed to be done rather acutely. Then, of course, we have what you just mentioned just now, increasing human resource in terms of psychiatrists, clinical psychologists, and counselors, and also bringing and building a system where we're all working together to cater for the mental health needs. And, of course, the third one is prevention, where, we're trying to advocate for better mental health care among the population, knowing very well that the pandemic is going to rear its head in terms of mental health. We know this already. Countries have reported this, and people have been prepared. So we just need to ensure that we do these things in order to reduce the risk of further suicides as a result of this, pandemic.
Dr. Amer, in terms of, the way in which we, the general population, think about mental health, that suicide is a particular type of symptom of it, do you think we appreciate that mental health problems can happen to everybody, or do we think of them as happening to some people who are weak, who have some underlying problem, who can't kind of like pull themselves up by the bootstraps? What should we address in terms of how we as a society think about mental health problems, especially in a time of crisis like this?
Well, I'll take your second offer up a little bit more there, Sharaad, because I think you're right in terms of, although we have a rise in mental health awareness, but I think it's not risen fast enough. And I think what the COVID pandemic has actually done is actually accelerated mental health needs and issues to the fore. But as we are really seeing, the lack of investment over the many years in mental health care, the lack of awareness among our populations in terms of mental health has actually resulted in a situation where we are now playing catch-up to a situation which does not wait. So I think, although I'm optimistic and I've seen a lot of growth over the last 5 years in particular in terms of mental health awareness, I think there's still a lot of work that we can do in getting this awareness across to various segments of our population, various individuals with various language issues, for example. I think, definitely suicide and its awareness and mental health awareness needs to actually be strengthened further in our country.
Thank you so much for speaking with us, Dr. Amer, and for joining us from hospital while on duty, and for the good work that you do. Thank you. We really appreciate it. If you or someone you know needs help, please reach out. We've got some numbers that we will display throughout the show. But right now we're going to take a quick break on Consider This. We'll be back with more. Stay tuned. Thank you so much for staying with Sharaad and I on Consider This. Joining the conversation now, we have Dr. Chua Sook Ning. She's a clinical psychologist and the founder of the mental health NGO Relate Malaysia. Good evening, Dr. Chua. Now, throughout the show, we've been talking about the increased rates of deaths by suicide that we've seen during the periods between March to October, during which we've seen quite a number of series of lockdowns. Apparently, it's now about one death by suicide every day, and we're trying to make sense of this number, this increase in this uptrend. What do you understand to be the underlying reasons for the increased rates of death by suicide during the lockdown period, Dr. Chua?
Well, definitely we know that, yes, psychological distress, emotional distress can increase the likelihood of suicide, but really it's negative life events has been a really great risk factor for suicidal behavior, so especially interpersonal conflict.
Well, Dr. Chua, seeing how, the lockdown really isn't about a domestic issue, it's larger, it's even larger than the country, it's a global pandemic, and the economic fallout is also global in nature. How do you begin to make sense of that for somebody who is feeling a personal pain as a result, or finds themselves in crisis? how do you, when it's not something within their control, as it were?
Yeah, I think you're right. It's not just a domestic issue, and that's the first thing to recognize is you're not alone in either feeling anxious or feeling worried or being sad about the state of things, that this is, to some degree, a very normal response to a health pandemic that is tremendously disruptive to so many people's lives. But having said that, it doesn't mean that you can't get support, because it's really quite a normal response to the increased stress and just so much uncertainty and even grief. That's why you can get help at this time.
Well, are there barriers to getting help? I mean, not just in terms of not knowing where to reach out, but also, kind of fundamental, maybe cultural barriers or societal barriers that have been put in place. I'm wondering, perhaps, looking at in terms of men, would something like masculinity be a barrier to reaching out for help?
For sure. We definitely see that fewer men generally access psychological services for help. They tend to cope by keeping it to themselves, maybe an idea that they have to be stoic and not share or not even feel any emotion. They feel a tremendous burden of responsibility to carry everything and to be strong. So I think that is associated with decreased help-seeking behaviors, and especially, I think, as you said, it's just stigma about seeking help, that people think talking with someone or getting help during this time means in some ways that they are weak or, inadequate. But that's really the opposite. Seeking help right now means that you are taking that very strong, courageous step.
Dr. Chua, because Malaysia is such a diverse country, in terms of your research or what you understand in terms of people's ability to access healthcare, mental health care, urban populations versus rural populations, urban populations may be closer to hospitals, can pick up a phone easily to get some help, but also maybe there's deeper isolation in cities than they are in rural areas where communities are much more closely knit and families are much more present. How do you see all these different factors working out in this particular crisis?
Well, as you pointed out, there's so many different factors, but I can give you maybe a brief overview. Generally, the mental health resources are centralized in urban areas, and individuals in rural areas have fewer access to mental health services. Now, you rightly pointed out that there is a greater sense of community often in rural areas, but that also means that can be a bigger barrier to seeking help. You don't want people to know that you are experiencing difficulties because everyone is so close to one another. So, I think maybe counterintuitively it can lead to less support during that time.
Right. And what can we do in terms of, kind of early warning signs if you're worried that someone who is in crisis, before it reaches to the point of suicide, what early warning signs are there? What can be done to prevent anxieties into developing to be a bigger problem like suicide?
The common warning signs, especially in our collectivistic culture, is social withdrawal. Then other signs include loss of appetite, difficulty sleeping, you're feeling lower in mood, you're maybe on edge all the time, you're just always fatigued and tired, you have difficulties concentrating, somehow you're just not present anymore, you're just not feeling happy or you're not thriving. And while I think many people say, well, right now it's very difficult to thrive, it doesn't mean that you don't deserve help. You're right, it is very difficult right now to feel tremendously happy. But that means because it's so difficult, you should get the help to at least cope in a better way during this time.
Right. Dr. Chua, do you think, correct me if I'm wrong, is it kind of a stage-by-stage development that leads somebody from being kind of sad to then up the scale into a point where you tip over into suicide ideation was a word that was used earlier, and then perhaps even the actual attempted suicide? Or could it happen, could you just leapfrog from being reasonably sad to being suicidal? How does it work, actually?
Well, there is a continuum of mental health that people don't jump from I feel sad one day to depressed. It's generally that kind of more and more contributing factors, stresses pile up and your resources to cope kind of dwindle. And yes, then you could find yourself in a state of depression or in a state of whatever other mental health condition. But it should be said that especially among Asian populations, suicide doesn't just happen among people with a mental health condition. Many people in Asia, about even as high as 40%, don't have a mental health condition when they end their life by suicide. In fact, it's often something that they find is just a tremendous amount of distress at a certain point of time, particularly a loss of job, or they don't want to feel loss of faith or interpersonal conflict, and it's just overwhelming at the time, and they take the act to die by suicide.
Dr. Chua, thank you so much for speaking with us. We really appreciate your time and you joining us on the show tonight. We do. Thank you.
Thank you for having me.
Once again, if you or anyone you know needs help, please reach out for support. We have some numbers on the screen right now. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching and good night.
Kulim, Kedah, beginning Friday.